Good. Hi, everyone. I see a lot of familiar faces, so welcome back. And if you're new, I'm Dr. Stephanie Kane. I'm a practicing foot and ankle specialist down in South Florida. I'm in the Boynton and Boca area. And we're just going to discuss a little bit of common foot stuff today. And then I know everyone has lots of questions usually, so we'll leave a whole bunch at the end for questions. We'll just go over a couple different common things that kind of go on with the feet. Let me go ahead and share my screen. Everyone can see that now. So we're gonna look at some fun foot facts. So let me get the other one up so that way you don't have to watch the boring one. Can everyone see my screen still, or is it?
No, it went off.
Oh no, technology. Hold on.
They were gonna call Julius in on this one. He'll be to the rescue.
Share screen. It should be this.
There we go.
Play from start. Okay.
Yep.
So common problems of the feet. So some fun facts, 75% of the US population actually suffer some foot pain. There's actually, a huge population that has a lot of different foot issues, everything from wounds to ingrown nails to broken bones to arthritis. There's actually about 250,000 sweat glands in your pair of feet. So you can actually excrete about half a pint of moisture a day. And the foot actually has 1/4 of all bones in the whole body. So definitely keeps me pretty busy, which is always a lot of fun. A really common complaint we'll start with is bunions. Bunions are a deformity and pain to the big toe joint. This is actually one of my patients on the right side. And you can have the toe start to deviate over time. You get a bump on the inside of that foot. They can get worse and worse and worse as the time goes on, or maybe even they quickly get worse. They're usually inherited. However, you can get them from shoe gear, you can get them from injuries, you can get them from arthritis, you can get them from the type of activities you participate in. And unfortunately with bunions, they are usually permanent unless they're surgically corrected, because they are considered what's called a structural deformity. So unless we kind of go in and fix what's causing them, they usually are permanent. However, they can be treated conservatively as well, with orthotics, with stretching, with spacers, all those kind of fun tools. The signs and symptoms of bunions, you usually will have foot pain when you're walking or wearing shoes in the area on the bottom of the base of the big toe. This can be relieved by rest. Some people still do have pain after resting or in the middle of the night. There is a nerve that kind of runs right along the side of the bunion as well. It is common to have kind of numbness to that side of that toe. You can get swelling, redness, soreness around that area. That skin actually thickens in that area. And there's a capsule there too. So you kind of get a little bit of thickening of that skin, or you get a little soft tissue kind of swelling. The big toe starts to move a little bit differently. It may not have the same motion that it had before. And then the big toe kind of comes on over and it cranks it over to the side and it starts pointing towards the smaller toes. And even sometimes that can overlap and it can cause a lot of wounds or calluses, irritation and pain. Another really common thing that I see every day, and I'm sure, if I look down at my foot, you don't want to see my feet. I'd tell you the same thing, are hammer toes, claw toes, and mallet toes. So we all call them all hammer toes in a sense, they all are, but they are based off where the deformity is in the toe. And they kind of alter the little small bones of the toes. You can get stiffness, pain, the toes may start to curl. The baby toe, the fifth toe on the edge, sometimes starts to curl in and under and rotate around. Very common. Can be caused by tight shoes, any injuries to the toes, those walls that jump out at you, and the bedposts that jump out at you and kind of hit those toes and fracture them, and they kind of heal the wrong way, and they can kind of cause a little hammer toe like dysfunction, nerve problems to the toes, arthritis. We do see them a lot with diabetics. That is part of the foot kind of function with it. The treatment really for them is offloading the toes. Doctor may give you a little padding, a little splinting. They may strap it. They'll tell you to wear different shoes, whether it's wider toe boxes or a bigger shoe or something with more support. I'm in Florida, so flip-flops all the time, but you're grabbing the ground. So maybe they'll tell you, make sure that you're wearing shoes with support, so you're not kind of grabbing the ground. And that's kind of, the conservative treatment. After that, it's surgery for hammer toes. There are two different types of hammer toes. One is flexible. So if you're able to kind of move at all the joints, that would be more of a flexible hammer toe. And one is rigid, when you kind of can't move that joint, and it stays rigid on you. That when it's rigid, the bones become kind of, and the tendons are pressed into that alignment. And that definitely needs surgery to fix. Some of the flexible hammer toes can be fixed by soft tissue, monitoring and splinting. They can be fixed by kind of releasing some soft tissues, even just in office, not needing to go to surgery. So definitely something to get looked at, especially if you're starting to develop any corns or calluses on the top of the hammer toes. That's really common as well. And we just don't want any wounds or any kind of issues with any of that. Another really common thing that we see is heel pain. So the pain can be underneath the heel or behind the heel. You can get it when you're either resting or when you're up and walking. There are so many causes of heel pain. This is just a couple of them listed. Tendonitis, ruptures, bone bruises, cysts, spurs, bursitis, fractures, gout, neuromas, bone infections, peripheral neuropathy, problems with the way you're walking, arthritis, tarsal tunnel syndrome, so many different types of foot heel pain. But the one that we see pretty common and is usually very common every day, I see it at least a couple times a day, is plantar fasciitis. As common as 1 out of 10 adults usually, unfortunately, have the symptoms of it. Then, that means like few of you out there have had this. It's usually about first step out of pain in the morning. You may have a sharp pain that first step, or maybe if you're resting and reading a book or eating dinner and you get up, it takes a couple steps for that heel pain, that foot pain to kind of ease up, and you kind of forget about it throughout the day. And then you rest again and it happens again. It can also hurt you all day long or at the end of the day. And it's actually estimated for 11 to 15% of all foot symptoms. It does affect about 15 to 20% of people who are runners, but it's also really common with people who are not active or as active as a runner. I'm not a runner, so I put myself in the non-active individual, and that's at a rate of 65% actually in the non-sports demographic. Really common with military personnel because of the type of shoe wear, construction workers. It affects both genders pretty equally, but the women just a little bit more than the men. And usually you will see it on one side over the other, but it can be on both sides of the foot. And it does kind of pose a hard way of treating it and trying to figure out which side is worse, because we need both of our feet to get around. So something I see a lot is I have patients that come in and say, I hurt my foot. Something fell on it. I stubbed it. Someone stepped on it. And do I have a fracture? So how do we know if you have a fracture? Usually you need an x-ray to be diagnosed for a fracture. Sometimes you'll have pain directly, or usually always you'll have pain directly over the bone. So if I touch the bone in office and you're like, ow, that usually means that something's going on within the bone. You'll feel that pressure and discomfort. You may have a decrease in movement and an increase in pain when you move. You may hear a crunch or a sensation of bones moving or cracking. And bones actually take 6 to 8 weeks to heal on average. So it is kind of important, if you think you have a fracture, to start splinting it and taking care of it earlier on, so that way you don't end up with more of an issue down the road. Now, sometimes we do get stress fractures, especially females, especially postmenopausal. We just don't have the luck of the softer bones, a little bit increased risk of osteopenia, osteoporosis, and just even from walking, you can get a stress fracture in a bone. That stress fracture sometimes shows on x-ray immediately. Sometimes it is delayed up to 2 weeks after getting that initial fracture, the initial x-ray and initial pain. So we do want to make sure that you're getting that checked out, taken care of, and making sure that there are no fractures in the foot. But definitely another common thing people kind of put off, or they wait a couple weeks, but definitely check it out. Make sure you have an x-ray. Another really common complaint is I have flat feet. So flat foot is also known as pes planus. It's just a collapse of the arches. So the sole starts to fall down to the ground, and it affects about 30% of all people. It is usually genetic, so we can blame mom, dad, grandma, grandpa, but it can also develop over time. And the symptoms usually you feel tiredness in the foot, you have that fatigue, you may have difficulty rising on your tippy toes, whether one-sided or both-sided. You may start experiencing some knee pain, some back pain. Everything starts at the foot and it's a big column and it holds your body up. Treatment usually starts for flat feet with orthotics, some offloading padding, some pain relievers, anti-inflammatories, physical therapy, and if nothing really suffices, you may end up with some surgical intervention to correct that flat foot. Another super common thing, I think I saw it like 7 times yesterday in the afternoon, was a neuroma. So patients come in and they feel like they have pain at the ball of their foot. They have shooting pains to their toes. They don't know, they didn't have any injury. They don't know what it is. And all it really usually is an inflammation of the nerve sheath. The nerves run right in between those long bones of the foot, and any kind of crowding, squeezing, unfortunately, for a lot of times it's in females who wore high heels for a long time. They overload that forefoot, they put a lot of pressure on that forefoot, and you kind of feel this shooting, burning, tingling pain. It may act up at night. It is very common in what's called the third inner space. So if we start at the big toe, big toe, this little the toe next to it, the second toe is the first, second, third, and fourth inner space. The third inner space is the most common. And it's most common in middle-aged women, usually due to that high heels and when they were young and they wanted to look good in the high heels. And that pain is in the ball of the foot. It can send you a little shock to the toes. If you kind of squeeze the foot right in between those two bones, usually the patient will kind of jump and say, oh yeah, that's it. And we kind of know it's in that nerve sheath and it's an inflammation in that nerve sheath. And it's usually treated with some offloading, anti-inflammatories, injection therapy. And if all else, sometimes you need an MRI to take a look at it, and you may end up in surgery as well. Along with neuromas, a lot of times the same spot of the foot is that ball of the foot. You have pain, what's called a plantar plate injury. There's a strong little ligament that attached to the toes, the bone of the foot. The long bone attaches to the little tiny, and it's called the metatarsophalangeal joint. I won't quiz you on that or the spelling on that later, but it is a big word for a little joint, and it's a tough fibrocartilaginous structure. And what that means is that it's a little bit of cartilage and a little bit of fibrous tissue. So it's all kind of bounding the foot together, and it's how it's supposed to be. But any kind of motion, any kind of tear to that area, overloading and pressure can cause pain to that plantar plate. And it can be gradual over time, or it could have been you played around the pickleball like everyone does down here in South Florida, and you kind of get a little pain in that toe. If progressive, a lot of times we start to see the toes start to deviate out, what I call a peace sign, and they start to kind of separate from each other. And those toes usually are scarred down due to the plantar plate injury. Again, an MRI can be used to assess this soft tissue injury as well. Another really common thing that I see all the time is people say they have a foreign body in their foot, or they think they have a wart, or they have a callus, and they feel like they're stepping on a pebble. And if it's not usually a deep pebble, usually it's what's called an irretractable plantar keratosis. And what this is a clogged sweat gland. And it looks like a little callus on the foot, but it just feels like deeper than what a normal callus on the outside would feel like. It's just thickened, dead tissue with a tunneled core into the skin that you constantly feel like you're walking on a foreign body, you're walking on a pebble, that pebble's in your shoe, you can't get it out. Typically it's on the ball of the foot because it's a pressure area. However, you can see it anywhere, especially where there's pressure. And a lot of times all it is that we kind of shave down the lesion, we clean out the core of it. Sometimes there's creams, there's offloading pads, stretching to kind of eliminate pressure, orthotics. There are some surgical kind of things that can be done too, but usually patients with a little TLC in office, I like to tell them they'll get rid of it and kind of move on with their lives with this. And then foot cramps. So a foot cramp is sudden, uncontrollable, intense muscle spasm that can last from seconds or hours. It wakes you up usually at night. About 25% of people over the age of 60 experience it. You want to grab that foot, you want to massage it, you want to walk on it, you want to do whatever you can because the pain is just so intense sometimes. It usually comes from a couple different things. Dehydration is a huge one. The lack of vitamins and minerals. Usually it's potassium and magnesium. Muscle tightness. If you just done a little bit too much that day, or you didn't do too much that day. Either way, it can kind of cause your muscles to interact a little bit differently than they do usually. Fatigue, if you've just been tired, if you've had a recent virus, or, that's what we've been dealing with the last year, it can cause the foot cramps, dehydration. Nerve damage, if it's coming from the lower back, is very common. So if you know something that's happening just when you sit down, just when you lay down, it may have some kind of lower back component to it too. And then poor circulation also can lead to this. It usually starts with a sharp, intense toe, foot, arch pain, calf pain. It's just a muscle spasm. Your toes want to curl. And then another really common thing that we see, ingrown toenails. It's also known as onychocryptosis. And it's just when the ingrown nail, the condition kind of worsens and it grows into the side of the toes. The soft tissue on the side builds up, gets a little bit thicker. You start having pain, discomfort when walking in certain shoes, tight shoes for sure. You may get pain, redness, swelling. Sometimes, unfortunately, it gets to a point where there's some pus coming out and you have a little bit of an infection to that area. It does come from tight shoes, cutting your nails too short or not straight across, injuring that toenail. If you genetically just kind of have curved toenails, and then any prior trauma can change the shape of the nail for good. So what usually it is, you soak your foot in some Epsom salt warm water, soaks a little bit of antibiotic cream to the border, or a little bit of lotion if it's not infected. Usually it'll kind of treat itself at home. Some patients, cut it back themselves. Sometimes it works. Sometimes they end up with a bigger issue. But if you come to see me, usually it's lifting the nail, splinting the nail, removing the nail, whether it's a partial nail removal or total nail removal. When you can go in and do a phenol and alcohol matrixectomy. And what that means is we remove a little bit of the nail. At the base of the nail, we put a little chemical at the bottom to try to permanently kill that nail root so it doesn't grow back again. That's a great option for people who have this repetitively. It's usually not an option for someone who has an infection, an active infection. So that's why it's good to get these treated before they get to an infected status. And then sometimes people do end up with surgical excision for that treatment as well. So to prevent some ingrown nails, wear properly fitting shoes, trim your nails with clean instruments. That means if you're going to the nail salon, making sure that they are all clean, sterilized. Now they use all the little shower caps for the foot spas. Even then, sometimes the filter gets a little bit of bacteria in there. Always cut your nails straight across. Don't pick or tear any of your nails. That's a big thing. A lot of people like to pick at their cuticles. Try to stay away from it, and keeping your feet clean and dry should really prevent some of those ingrown nails as well. So that's it with a couple common things, and we'll open it up and we'll have a nice discussion on all of your feet.
Yeah. Well, we're going to start up. I know Frida had mentioned that she has gout and it involves the whole foot, not just the big toe. Is that usually how any thoughts on that?
Yeah, and so gout is very common. Unfortunately, it's painful, red hot, swollen joint. If you feel like it's just not responding to anything, sometimes there needs to be a little bit more of an investigation into it. It is most common in the first big toe joint in the foot, but I see it all the time in the ankle, in the midfoot, in the little toes. It can flare up any which way. Now there's two different forms of gout, and the best thing to do is find out which one you are, if you're an over excreter or an under excreter of the uric acid, and to kind of balance it out. It's also important to kind of see what is causing your gout attacks. So is it a certain food? Is it a certain activity? Usually it's a food that's rich in purines, Purines. And what that means is it's all the good foods, the red wines, the fava beans, the meats, all the shrimp and all the shellfish, all the good foods you could think of usually are a lot of foods that will increase the uric acid, increase a gout attack. So sometimes just keeping a little journal, what you ate and when you kind of felt that flare up, so you can kind of just stay away from that food in the future.
Okay. And I see there's more questions in the chat, but Rose, you have your hand up. Go ahead.
Okay. I have neuropathy, which is, I know that they just did some testing on me and stuff. In fact, they're going to send me for some foot care or stuff, but I still have some questions. What do you recommend for an exercise or stretching for an ankle that has a real lot of arthritis in it? And I walked on it for about 4 years with a bad knee. So it got overused. And now that the knee's been replaced, I'm trying very hard to get it to move in the proper way so that it doesn't pop and hurt every once in a while. Sometimes it pops off to the side and it's like I'm going to go down, and I don't want to do that. Is there something that I can, stretching or an exercise or something that I can do to help that?
Yeah, and so in terms of arthritis, and unfortunately I can't see your x-rays to tell you one way or another, but sometimes it is bone on bone, and so it kind of holds
Yeah.
the joint where you can't kind of get it up past 90 degrees. And so that whole pulling your foot towards you is hard because you're not really getting, the bone is hitting the bone and making a hard stop. Are you feeling like a pop or an instability in the outside of the ankle? That could be,
Yes.
yeah. So that's probably more tendinous as well, along with the arthritis and the pain in the ankle joint. And so just kind of strengthening that. If you have it where you can't kind of get your ankle up past at 90 degrees, some really good exercises just when you're sitting down and just kind of taking it easy is write the alphabet with your ankle. What I mean is just take your foot and just go like A, B, as much as you can. And that kind of activates a whole bunch of different tendons, loosens them up. Pulling the foot towards you where the resistance band is a really good exercise. However, if you can't get it up because of if the bone on bone is stopping you, it's not going to do too much, but kind of holding that foot up at 90 degrees and kind of just let it 10 seconds and let it go 10 seconds, pull it back up 10 seconds, let it go 10 seconds. Physical therapy is also a really great modality and to kind of utilize for everybody for a lot of different reasons. Someone's there, they can work through clinically, they have all the different modalities, they can really kind of work one-on-one with you and kind of what's going on. It's hard from being out, I'm not able to touch your ankle and be able to tell you exactly like what's going on, but definitely just keep it moving, keep it going. You want to strengthen it. If you can push in against, push in, hold it for a second and pull out, push in, and that way you kind of strengthen a lot of the different tendons and muscles.
Okay. And the other one I wanted to ask was, are there any particular shoes or inserts you can recommend to help with walking after knee replacements?
Of course. So you want a good supportive shoe. Some awesome brands of sneakers that we recommend pretty frequently. Hoka's, Hoka, are a great one. They are a little bit bulkier of a base, so some people don't like that part of it, but they are kind of like walking on a cloud. New Balance, Asics, those are all really great options. They also have wide options, which is a great thing for people who have a little bit wider of a foot. They're not trying to slide into a narrow shoe that looks pretty. So then they're definitely getting, a lot more support. Over the counter inserts, you want something that's going to be what's called a functional insert. So there's two different types of inserts. One is accommodative and one is functional. Accommodative is a lot of those squishy jelly Dr. Scholl's brands that we see at the pharmacy that we get off the shelf. They make our foot feel good when we're wearing them, but they're not actually training our foot to actually have some support. The functional insert is one that when you push down, I'm gonna see if I have one laying around. Oh, give me 1 second. When you push down on this mid part of the foot, no matter how much weight I put on this part, it's not going to collapse down. This is one of my patients. It's not going to collapse down. It's going to hold that foot in a normal position and then kind of let them walk heel to toe. So what you want is something that's going to be rigid in the middle. And if you see, I have no give on this guy. So this is what's called a functional. More of the accommodative ones are usually more of this soft and squishy part of the material. So you want something that's functional in nature. A lot of the times you'll go to the pharmacy and get on that little stand and it'll tell you which ones are the right ones for you. And they're not always the most supportive. But they're doing something for you. It's better than nothing, but definitely something. It doesn't have to be a custom insert. There are many, many different types over the counter that will give you that support.
Okay, thank you.
Of course.
And I know you just touched on this, but Anna had asked exercises to strengthen the ankle. So I think you sort of just went through that with Rose with what to do. I don't know if there's anything to add on that.
Yeah, I mean, I can also put together, if you give me a couple, I can put together a little exercise sheet for the ankle and I could have it
Yeah,
sent to you guys so that
That would be
way
great.
you'll have little pictures or whatever it can be.
that would be so helpful. That would be amazing. Okay, so we'll do that. We'll send that out whenever you can get that to us. We'll send that out to everybody.
Awesome.
Okay, so we have another question here that came in, Positive Pat, sorry, Sharon wrote, what can be done if a toe is broken? They're just talking about this.
We have lots of broken toes on this
Yeah.
call. If a toe is broken, so I wish I could show you pictures of my feet and so my x-rays of my feet. When I was in training, I took x-rays for training. I said, hey, you want to practice on and everyone was like, what'd you do to your toe? So I am a really good person that walls like to jump out at me, the bedposts like to jump out at me, desks, everything likes to attack my feet. And a toe fracture, although it's just a toe fracture and usually response is if you Google it or you talk to any kind of, doctor, they'll say, oh, the only thing you can do is splint it, which is true. You can kind of buddy tape it next to each other. And so what you usually do is you kind of take the tape in between the two toes and then you kind of wrap them together like such, and you kind of make them friends, is what I tell my patients. However, sometimes those fractures can actually be dislocated, or they can be displaced, or they can be what's called comminuted, which means in many different pieces. So although it's just a toe, sometimes they need a little bit more love and care than just splinting it. They may need to be set back into place to heal properly. Sometimes setting back into place is as easy as just kind of like pulling it over with no anesthetic. Sometimes we have to numb the patient up and pull it back into place. And sometimes it ends up in surgery with pins in it or with, a cast or a splint around it. So I would say about 90% of the toe fractures that, we see walk in usually don't need that. But in case of anything a little bit worse, it is always good to at least get a follow-up care on the toe fractures. But it is just taping the toe together, which is called buddy taping. So they're friends together, and then a stiff-soled shoe. So something that's going to give you support and stiff, that's not allowing you to push off the ground. So you're kind of splinting it and immobilizing it. The bones, which we touch on, do take 6 to 8 weeks to heal. Unfortunately, sometimes bones do take a little bit longer if your vitamin D is a little bit lower, or your calcium's a little bit lower, or you have osteopenia or osteoporosis. I do commonly see, that the toe fracture is healing pretty much on par with the 6 to 8 weeks. And you're walking in a shoe, you're just kind of making it friends with the one next to it. And it may be tender on the bone. You may see bruising. The bruising may come up the foot just a little bit to the midfoot, but that's pretty much what you can do for a toe fracture.
Okay. And Positive Pat asks, what do you think of foot pads that supposedly detox the body?
So I don't know. I don't know enough about them. I have seen all those foot pads and it's on my list of things to kind of check out personally. I do know that they kind of, what I've seen from the advertising, they go on the foot and they kind of like suck out the toxins. There's a lot of people, Western versus Eastern medicine, who really do believe that detoxing your foot can detox your whole body. It goes along with the whole acupuncture things too. There's a lot of pressure points in the foot that are connected to points in the body in that type of medicine. It is something I am definitely on my list of things to look at, that and then some of the exfoliators that they have now for the feet. So I will get on that and get back to you guys and tell you how it works on my side.
Yeah, maybe by the next session we can we'll have an update on that. So stay tuned.
I'll take pictures and see how much comes out. That's all the videos I see online. They're like all these like pictures and like videos, and we'll see if it really works for real.
There you go. Okay, Beth Avery, I feel like there's paper on the bottom of my feet when I wiggle my toes. They don't seem to be calloused. I've been moisturizing them, but not sure if it's helping.
So a papery feeling on the bottom of the feet could be from a couple different things. It could be like you kind of alluded to, calluses. It could be dry skin. It could be an athlete's foot, which is called tinea pedis. It causes flaky dryness, can cause itching or papery feeling to the bottom of the foot. It could also be due to nerves. Very common, do I feel patients feel like paper on the bottom of the foot is actually a nerve kind of discomfort, whether it's neuropathy, whether it's radiculopathy, meaning that it's coming from the lower back and kind of shooting down to the foot, or neuroma. It usually is a lot of times, sometimes nerve related. It's hard without seeing the actual foot to tell you if it's something, like skin related or if it's something nerve related, but it's definitely something to get worked up and figure out. And also take note if it's on both sides or one side more than the other, one area more than the other. That's a lot of times what the doctors will kind of try to get to and try to see what's going on.
Okay, and Barbara, I see you have your hand up. Go ahead.
Yeah, I suffer with a lot of things. Well, I don't want to use the word suffer, but I have a lot of things usually go on with my feet. And one of them, I have a lot of callus, and it's in my family. We have like really cute looking feet. It looks like it's cute, but then it's hard with callus underneath. So I'm always going to the nail salon to have my feet done in order for my feet to stay, that they don't get too hard and cracky and everything else. So like you, I'm always bumping into something. I call it blind feet. I always bump
like it.
I trip over something, broke a toe. I had heel spur one time. The doctor, excuse me, the doctor, they had me measure for orthotics. So that was many years ago, and I no longer have it, But whenever I take an x-ray, the doctor tells me it's still there, but it doesn't bother me, right? My question is, do you think I just feel I should give my feet a little bit more pampering? I like to pamper myself and including my feet, but I still think it's not enough. And I see a lot of foot spas around my neighborhood. Do you suggest pampering, going to a foot spa, get a massage, whatever?
Yeah, for sure. I'm all about pampering yourself as a whole, but I'm all about foot pampering for sure, because that's what I see all day. We kind of neglect parts of our body and ourselves until they kind of break down. Same things with our cars, it's easier when things start aggravating you, hurting you, bothering you, to kind of be like, oh, well, now let me take care of it. So it's always good to stay on top of things and kind of take care of things. So yeah, for sure, going to a foot spa, now making sure it's a clean one is key, but going to a foot spa, getting a massage, taking care of it, pampering those feet can only help you in the long run. Things like calluses can turn into wounds when they're too thick. They just kind of thicken over time in the tissue under the callus. And you say, hey, it's just a callus, I've had it forever. But the tissue under the callus can get damaged and can cause a wound. So if you're just going, and you're kind of preventing the dry skin and callusing, that could prevent wounds in the future. The massage, if you have aches and pains, sometimes patients with plantar fasciitis, for example, they say that they have a great relief just by when they go and kind of have their foot massaged out, because it's alleviating a lot of that tightness and the tenderness. So anything that's going to keep you feeling good, I completely and totally support.
Okay. So Sandra and Rose sort of had a question regarding the same issue, but different. So it's about nails being thick. So Sandra asked, what causes a nail to become thick, and is there a way to prevent it? And piggybacking off of that, Rose said, what do you recommend for thick nails to get down? She's on blood thinners, so she's afraid of cutting it or grinding it too close because she just doesn't want to cause any bleeding.
Yeah, so thick nails. So thick nails come from a couple different reasons, and I actually left this out. I guess I should have thrown it into the PowerPoint. The thick nails can come from, one, it can come from micro trauma. What that means is over time, just hitting shoe boxes, your toe getting pressure, can usually cause a nail to like thicken over time. It's a big word called keratinization. And it's just the thickening of the nail. That can either be, I guess, reversible, where it grows out and you don't have it again, or it could have damaged the nail plate, which is all the way in the back of the nail matrix at the bottom of the nail. And if it damages down here, sometimes it will grow permanently back thicker. It may grow, the nail cycle is 9 months, usually 9 to 12 months. So it may grow out once and you never have the thickening again, or it may just constantly kind of causing thickening. The other way we kind of get thickening is with fungus. And sometimes they go hand in hand. You had some trauma, you stubbed the toe, it lifted up a little, the fungus had a perfect way to getting in, and it came in, and now the nail's thick because of fungus. And sometimes we see that at the same time, the thickening of the nail from trauma and the thickening from fungus. And then the trauma can be tight shoes over time. It can literally be from anything. Ways to kind of prevent it is, if you've already have it, we need to treat it, and we can kind of step back and kind of go over that part. So if you already have thickened nails, what I usually do when I see a patient in office with thickened nails, you can take a sample of nail and send it to the lab and confirm if it is fungus or if it is just trauma. If there is discoloration, with, sometimes they do have like little beauty marks or discoloration in the nails, people get concerned. They can be malignant, so they can be cancerous sometimes. So it is something to pay attention to. If you have streaks of the nails, it is more commonly seen in the African American community with streaking of the nails. So these are all things to kind of take notice of if that's going on with the thickening. But when I see a patient, if we take a sample, we send it, we see what's causing the thickening. To kind of get it down and treat it, I do kind of cut the nails back and I file it down. So if you're on a blood thinner and you're worried about that, the best thing to do would be to find a local doctor that you really feel good with and have them kind of debride the nail down for you and thin it out and kind of take care of that. I don't always recommend people doing it at nail salons. There are some nail specialists who are trained and they're medically trained for this kind of stuff. However, if you're on the blood thinner or anything like that, I would definitely, or diabetic, or even if you're not, even if you just want it, I would see the doctor and have them perform that. I wouldn't do it yourself at home, that's for sure. Treating it, sometimes it's just, if it is have a fungus element, it needs an antifungal for sure. If it is just a thickening, sometimes just certain natural oils can help. We have a product here that we use that has natural oils and an antifungal. And so even some of the patients who don't have the fungus, but they use that treatment, they see really good results with it. It is a patient's thing with treating it because the nail does take 9 to 12 months to grow out, like we said. So it is something you have to do every day for that time, usually about 6 months. So it is something that you look down. I'll usually see my patients who just want them kind of thinned down. I'll see them about once a month to once every 2 months to kind of thin it down for them, smooth it out. And they usually do see a difference over time, but it is a TLC. It is a maintenance thing. It is, if you do have damage though to the nail plate or you have fungus that isn't treatable, it's going to keep coming back thick and thick and thick and thick. So it is something to kind of get taken a look at. It's not the biggest thing, but it is something I would have someone look at for you.
Okay. And Patricia wrote, how is a longitudinal ligament tear on the inside of the ankle going down into the foot treated?
So is Patricia, are you still on?
Yes.
Patricia, there,
Okay.
go ahead.
Is it a lateral ligament tear or longitudinal ligament of a tendon?
I'm not exactly sure. I
That's
jumped
fine.
down from a cart and zing,
Oh no.
And yeah, the MRI showed that it was, it's not like a cross, whatever, the tendon or ligament. I'm not exactly sure. There are
Okay.
a lot of big words.
That's fine. They usually are a lot of big words. And so longitudinal usually means that it's like through the so let's say, so you said longitudinal ligament tear on the inside of the ankle. So on the inside of the ankle, there is a large tendon called the posterior tibialis tendon. That usually is one that commonly is kind of torn or has a little bit of dysfunction. Longitudinal meaning that it just kind of has a little split to it. It's not a complete tear. It's not a rupture, but it usually needs a little bit of TLC. Now, depending on the grade of the tear, sometimes it is immobilization, anti-inflammatories, and sometimes it is as big as they're recommending surgery because you're not getting any better. So usually if I see longitudinal tears anywhere in any tendon or ligaments, based off of clinical, if they're still have function, they have a little bit of discomfort, they're able to immobilize, they're able to decrease the inflammation, we're able to get them on a good plan. Sometimes that's the number one part is immobilization. Then after that, I'll maybe transition into some therapy, some strengthening, work that in after they kind of are healed. A lot of other stuff that's going on right now outside of surgical and conservative is stem cell injections or platelet-rich plasma injections. Those work awesome in soft tissue. So in ligaments and tendons, they work awesome in kind of bringing healthy healing factors to that area to amplify the healing to that tendon and to that ligament.
I did have some cortisone shots and they worked for 2 months
Okay,
and then it came back. I mean, so.
but you
just
still,
to
but
get
you're
the
still having,
inflammation.
but you're still having the pain after
Oh,
a few
yeah.
months.
Yeah,
So I would definitely get it reassessed because any pain, we don't like to see pain, period, but we definitely like to see pain that keeps repeating. Now, when it comes to shots, and I'm not sure where they gave you the shot, so I can't, but when it comes to shots, I personally don't like to do more than 3 shots in a given area over a year.
Yeah.
And some patients get relief, they get relief for 2 hours, and some patients get relief for 2 years and everything in between. So it is kind of how your body kind of metabolizes the injection. It's kind of how you wear and tear your foot in that time frame as well.
Mhm.
So those are all things you want to keep in mind.
Okay.
Thank you.
And then we have here, Jeanette, what are some conservative treatments for bunions?
Ooh, bunions are hard, but conservatively, we like to make sure that we kind of control the discomfort. That's the key. And so with the kind of conservative treatment of bunions, it may be splinting, meaning that you have little tiny spacers that kind of go in between. They kind of sit there and they hold it over. I've seen crazy splints on Amazon and online marketing, where they kind of like wrap around the whole foot and pull it over. It's not going to cause it to go back. We can just cause it from progressing forward. Wider toe boxes, orthotics, those are great options for bunions. You just kind of want to make sure that it doesn't get worse. If you're having considerable pain in the bunion, it is worth getting an x-ray, seeing what can be done too. If I have patients that have bunions that you look at and they're completely over and they never had pain, I have patients with the smallest kind of bunions and they have significant pain. The number one thing we want to treat is the pain, but conservatively, orthotics, spacers, strapping, physical therapy, training the foot to kind of walk in a neutral position. Those are all great options.
Okay. And Maxim, go ahead. If you want to unmute.
Yeah, I don't know if this pertains, but I get you explain to me. It's been my doctor explained it to me, but what is sciatica pain?
So sciatica pain is in the lower back. And so the nerve they all start in the lower back and they all come down to the toes. So sciatica pain is actually in your lumbar spine. You have a big nerve root that kind of comes called your sciatic nerve, and it comes down through the hip. And it can cause shooting, burning, tingling pain, like throbbing, aching on one side of the hip. Usually you feel it kind of in like to the side of your body, like in your gluteus area. You can get it from a syndrome called piriformis syndrome, meaning that little small muscle that sits there called the piriformis is putting pressure on it, or it could be coming straight from the nerve roots in the lower back. Sometimes it is a good thing to get an MRI of the lower back or a nerve conduction study to really kind of see what it's coming from, if there's any kind of stenosis in the lower back or any kind of damage or injuries to the lower back that's kind of causing it, or if it's just musculoskeletal kind of putting pressure on it and causing it.
It's musculoskeletal mostly.
Does it get any relief from anti-inflammatories or therapy?
No. Well, yes, I don't have that kind of pain, really. What it is kind of a knobbing pain. I could say not quite like a 5, not so much a 10, you know what I mean?
Okay. Well, the sciatic can be, it can be irritated from herniated discs, like I said, just stenosis, degenerative spine disorders and stuff like that, or it could just be from, a tightness in the soft tissue. So it is definitely something to get taken a look at and see what's going on and where it's coming from, because some things need a little bit more attention than others. But the sciatica is usually just nerve pain caused by some kind of irritation or compression of that nerve. and it kind of shoots down the leg, or it stays kind of in the outside hip area down the leg.
Okay, thank you.
Of course.
All right. So Frida Smith, she stepped her foot 2 years ago, always feels like a sock is balled under her foot behind her toes. Foot doctor said it's a contusion and will go away with time. Last year, she went to a specialist who gave her foot exercises, which did not eliminate her problem. So she just lives with it. So she was also told it could just be damaged tissue around the injured area underneath the foot. Any feedback on that?
Frida, are you still on?
Frida Smith, are you there?
Yes, I am.
Okay.
right.
So you stubbed your foot 2 years ago and it feels like a sock is bald there. Now, have you had an X-ray or MRI or anything of that sort?
No, I have not.
Okay. So
I had-
usually,
I'm sorry. Yes, I had an X-ray when it first happened,
okay.
and he said it was nothing broken. It's, it's just damage. It's probably a contusion, and it'll go away with time. And didn't give me any kind of medication.
Okay. And that was like 2 years ago. So a
Yeah.
lot of times when I see patients, if you like came to my office and you had the same kind of complaint, the first thing that we would do is really, kind of assess kind of what we spoke about on the call. Actually, I don't know if you were on, but the plantar plate ligaments. Sometimes that's something from the stub that can kind of tear that little ligament and kind of thicken, and then causes residual repetitive pain to that ball of the foot. Sometimes it is
Yes.
nerve related too, though, when it feels like a sock is balled up under. So I would assess for nerves, but I'd also assess for soft tissue. If it's something that you've had for about 2 years and x-rays are negative or were negative and are still negative, sometimes the best thing to do is to get an MRI to really look at that soft tissue. If it is thick damaged tissue, if it is something that tore and scarred in a weird way, even if it is an inflammation of the nerve that kind of making you feel that ball of sock under the foot, then an MRI would show all those kind of things.
Okay.
I know, all the fun stuff.
Yeah, exactly. Okay, I just never went back, after I did the exercises, and I was doing that. So I just got to the point where I said, well, it's not going away, and I'll just exercise. And, I just find myself living with it because I'm
Yeah,
not
but
having
no one should have to
excessive
live with pain. There's definitely stuff that can be done. If it's
True.
splinting or immobilization or further imaging for any of these kind of conditions, everyone should know there's always something that can be done. And that's why, they call it practicing medicine, because it's not always straightforward. Like, I see you, it's this. Sometimes it's a, a give and take, and we kind of figure out what's going on, but no one should live in pain or discomfort.
That's true. I agree with that, and I figured, probably old age and everything is getting, things are breaking and falling down with
Yeah,
age.
sometimes we
one
can
problem or
definitely, attribute it to sometimes of those, old age, arthritis, aches and pains and whatnot. But sometimes it is a little bit something more, especially when you stubbed it about 2 years ago. You had an injury. It wasn't like you woke up one morning and, hey, my foot kind of hurts.
Exactly. That's
So
true.
I would definitely follow up and see what's going on there.
Okay. Thank you very much.
Of course.
Hey, and Raylene, can you talk about plantar fasciitis treatments and how long it takes to heal?
Yes. So plantar fasciitis is very broad kind of category for it. So in the kind of acute plantar fasciitis, meaning that you maybe woke up a couple days ago, had some pain again when you woke up, and then you're like, I'm going to come to the doctor today. The acute kind of injury is usually easier to heal than something that you've had for months on end. So when you've had this for 6 months, 2 years, it's a lot harder to kind of heal. So the kind of any kind of plantar fasciitis, it's an itis. It's an inflammation of the tissue. So really what we need to treat is the inflammation. So early on we treat it with an anti-inflammatory, we treat it with strapping, with support, with orthotics, with stretching. Acute plantar fasciitis does do really well with stretching. Some patients they choose to do nothing else but stretch, and they see a big difference. They stretch like 6 times a day, and they say it makes a lot because the calf muscles are attached to the Achilles. The Achilles is attached to the heel, And the plantar fascia band is the bottom of the heel to the front foot. It's all one big system. And so when you stretch that leg, you're stretching all of those tendons, all of those muscles, and really helping to alleviate some of the discomfort and stretch that area. When you've had plantar fasciitis for a long period of time, or even a few weeks, months, years, sometimes it can lead to tearing of the plantar fascia band, which call it little tiny tears, which is inflammation within that band, making it a lot harder to heal, a lot longer to heal. It can cause stress reactions or stress fractures in the heel bone because of the tightness and the pulling. And really, if we're not able to get that inflammation treated with some conservative care, sometimes it does end up surgically. Surgically, it's going in and kind of releasing that plantar fascia band. So it is a very Pandora's box about how long it can take to heal. If it's something early on, usually it responds really well to anti-inflammatories, whether it's a steroid like a Medrol dose pack that your doctor puts you on, or it's an anti-inflammatory like a non-steroidal like a meloxicam or ibuprofen, orthotics or arch supports or strapping, and stretching. Sometimes an injection is given as well. A cortisone injection is given straight to the area as well. That's usually patients early on will heal and deal with that really well. If it's something that keeps coming back, we know something else is going on. I personally get an MRI. At that point, usually we'll see tearing, we'll see heel changes in the bone, and we talk about immobilization. If immobilization doesn't work, then we try to talk about, surgery, and there's physical therapy in there too. So it definitely could take a long time to heal, but if it's something that keeps nagging, I would follow up with your doctor to make sure it's not something more than just inflammation of that band.
Yeah, and I think Eleanor experienced something similar. She said the only thing that healed hers was after 2 years of sleeping with a splint at night, it finally healed, and I haven't had it since. Eleanor, is that regarding same issue?
Yeah, that was with the plantar fasciitis. And
Yep.
I really was angry with my podiatrist because they never said that to me in this whole period of time that I was suffering. All he said to me was do the stretching and wear running shoes for everything. And I did. I wore them day and night. I wore them to work. I looked like an idiot with my Asics shoes on. But I found out from a lady in Arizona when I was in a gym, and she said, I wore a splint at night and it
Mhm.
really made a difference. And it's just like a $15 cloth thing, and it keeps the foot straight up. Because I found that every time the foot goes down, you continue damaging it when you're sleeping.
Correct.
So
So night splints are awesome because yes, when you're sleeping, your foot is like this.
Exactly.
And then your blankets are like this.
Yeah.
So even more so than when you're sitting on so a night splint, what a night splint does, and this is what Eleanor was talking about, a night splint comes on, and there's a couple, if you Google them, or you look on Amazon, there's a couple different options. Some are big and bulky and they look like a big walking boot, and some are little socks that just kind of pull and attach and they kind of pull up. So there's all different types. But what it does is it stretches that foot at night, and it uses a whole bunch of physical therapy properties to kind of train the body that this is how it should be. So, and when you take that first step out of bed in the morning, your foot's already stretched. That's the most important thing. Your foot's already stretched, so you're not like this and then stretching it and increasing the inflammation. So thank you, Eleanor, for bringing, night splints are, if you can tolerate it at night, they're awesome. If you can't tolerate it at night, they're great during the day when you're reading a book, or eating dinner, watching a movie. That's just constant stretching for you.
Yeah, I thought it was just old age when I was getting that pain.
No.
And it started to go all the way up my calf. And finally I went to the podiatrist and started what you had talked about. But if I had had that thing in the beginning, I think I could have saved myself a year and a half of.
Oh yeah.
So yeah, thanks for listening to that.
Of course. Thank you for bringing it up. Night splints are awesome.
Right. And Rose, do you want to unmute? I know you said you had a picture to ask a question about, you wanted to show Dr. Kane. Hold on. There you go.
I don't know if you can see this.
Yep.
Kind of, yeah.
Okay. I'm constantly getting the callus on the big toe, and it grows really, really fast. I do not have any toenail on the big toe. It's a perpetual, I had perpetual ingrown toenails. The nail beds were no good. and they kept growing sideways instead of up and down. And then I have the third toe, the top of the toe is bent and it's constantly pushing on the two toes. So what can I do to help get that straightened out and get rid of the calluses on the toe?
So in terms of the third toe being bent, strapping or some kind of like device, they call it a crest pad that kind of sits under and keeps them kind of up and elevated is going to be your best bet for the third toe. The callus on the big toe. Now, it could just be a callus and due to pressure. I do have a couple patients right now who kind of have the same thing you described. They actually have a verruca or a wart-like lesion on that area, and that's why it keeps coming back too. So we didn't really talk about warts today, but if you debride a callus down and there's pinpoint bleeding or there's pain on compression, meaning if you squeeze side to side, sometimes there's a verruca or a wart underlying that as well. If it's just the callus from wear and tear and from pressure, making sure that you kind of are wearing good supportive shoes, wide toe box, an orthotic, or even there's some sleeves, they're called silicone sleeves that can kind of go over the toes and they can protect the friction and the forces that kind of cause the calluses on that area. I
wear really good, I wear Rika shoes and they have the extra insert in them. And I always have a wide toe box because I have an extra wide foot. And
so I would try next, I would try either there's silicone pads that kind of slide right over the toe and kind of decrease some of that frictional forces, or there's what's called like U pads that kind of go and they kind of, you put them on right around where the callus is. And those are kind of options to kind of help decrease the callus from coming back. The callus is coming back from forces of friction and from pressure. So we have to kind of control that somehow to kind of treat that issue.
Okay, and that third toe you said splinted?
Yeah, so there's a lot of different types of splinting, and you're just talking about it's curling over under.
No, it's permanently bent. I can't get it to go back.
That's because it's probably a rigid hammer toe in a way, and so
rigid hammer toe.
Yep. And so the one thing you can do is kind of try what's called a crest pad is one of the things. If you shoot me an email, I can send you a couple pictures of some different devices.
Okay. I'll get your email off the.
Yeah.
Yeah, we'll get that. We'll send that after. When we send the
type it.
presentation, we'll definitely include Dr. Kane's email. But Rose, I got to commend you. That was some drawing.
Yeah,
that was
I'm
pretty
going to
good.
have you come and draw like
That was pretty good, right? Like she was professional stuff there. I mean, like that was like a real good foot outline. She had the arrows. Very impressive. I loved it. So hats off to you, Rose.
Thank you.
All right. So then we have Patricia, any treatments for arthritis of the big toe?
So arthritis of the big toe. So that's kind of a Pandora's box too. So a lot of times arthritis starts secondary to having, other you're compensating in other parts of your foot. So you're putting a lot of more weight into that big toe, or it could be from trauma. And so usually when I see a patient with arthritis of the big toe, the first thing we kind of do is it's an itis. Same thing with it's an inflammation. We try to decrease the inflammation. If we can treat the arthritis with an anti-inflammatory, whether it's something oral or whether it's something injectable into the joint, awesome, even more so. Sometimes the patients get an anti-inflammatory and a stiff-soled shoe or an orthotic or something that's going to control their foot in a more neutral position or not allow that toe to kind of push off. Sometimes they end up with strappings that kind of there's something called a Morton's extension. It's a rigid kind of plate that goes from all the way up to the big toe. So that way that big toe joint can't kind of move and they kind of feel a lot of relief because that toe joint's just not moving. If it progresses to a point where the arthritis is just too much to handle, it's not getting any better with any conservative care, there are many different surgical treatments as well. Everything from cleaning up a joint to fusing that joint together to total implants into that joint. So there's many different surgical options. That's kind of based off of patient's preference, what the joint looks like, what the x-rays look like. and what our goals are in the future and how long we're going to use that joint for. But just to start out, it's usually anti-inflammatories, stiff-soled shoe, maybe an injection to that joint, and kind of go from there.
Okay. And then we have another question in here. I'm 54, very active. Recently, I've been doing intervals on the treadmill, only a mile or two, but about 2 to 3 weeks ago, started getting a sharp pain in my inner ankle, but only when I walk downstairs. Any clue what this could be? That's from Carla.
That now I don't see your whole foot, but if you're commonly flat-footed or anything like that too, usually the inside of the ankle and a sharp pain, especially in an active person, is the posterior tibial tendon, to be honest. And so that's common that people kind of say they have pain when walking down the stairs, or they feel like unstable when walking. So it's most likely that you may have just have a little tendinitis going on in the posterior tibial tendon if there wasn't any kind of trip or fall or twist, big twist.
Okay. She also added, there's no swelling or bruising and it is only on one side. It is fine when running, walking, or going upstairs, but going downstairs, it feels like there's a fracture. I cannot put pressure on it because it hurts so bad.
So sometimes there's an impingement too when you're just going down and you're not feeling it when you're going up or doing any other stuff. But it is very common with the posterior tibial tendon, which is the big tendon that runs on the inside of the foot. It is very common that you may feel the pain going down the stairs, or if you're on a hill, that tendon runs from all the way behind the ankle, runs from the leg, but it goes behind the ankle on the inside and goes all the way down to the foot, and actually is the main supporter of the foot. The first insertion is on what's called a navicular bone, but it's on the inside, midfoot, and then it dives deep down under. So we use this one quite a bit, and it does develop what's called posterior tibial tendon dysfunction. A strain is just usually something that's a little bit of maybe a little small tears or just a little inflammation in the tendon. If it hurts again and again and again, it definitely is something that needs to be assessed. Sometimes it responds really well just anti-inflammatories and bracing. Sometimes it responds really well with just physical therapy. So I would definitely get that checked out. But it is really common, the going just down the stairs, and being active and having posterior tibial tendon dysfunction.
Okay, and Dorothy, and I see Barbara, last questions. Dorothy, if you want to unmute, and then we'll get to you, Barbara. Go ahead. Dorothy. Hang on, let's just unmute Dorothy.
Can you hear me?
Yes.
My question is about, I've been having very dry feet. Is it related to not taking in enough liquids, or?
It can be related to a lot of things. It could be related to where you live. If it's a cold, dry environment.
Chicago.
Yeah. There you go. That's it. No, I'm kidding. I was in Chicago a couple of weeks ago. It was 12 degrees on Saturday and 53 on Sunday.
It's still tilting. 34 today.
It could be due to the environment that you do live in. In the cold weather, our skin does get a little bit more dry and more chapped.
Okay.
If it is itching or blistering, it could be due to athlete's foot. It could just be due to the crack. You have naturally dry, cracked skin. Making sure that you do keep it moist is most important. So
keep moist.
Yeah, you don't want it to get to a point where you're developing, I don't know how dry it, but in the heel, sometimes you get, or anywhere in the foot, we get what's called skin fissures, which are like little small breaks in all that dry skin. And that actually, they're small breaks. And so it can cause infection to come into it, or it can get deeper. It can cause a lot of a lot of kind of issues that we don't want. So any kind of dryness we want to treat with any kind of lotion, honestly. I personally just use stuff I buy at the pharmacy. If it's really dry, sometimes patients do really well with something urea based, UREA.
UREA.
Yep. And that's for the really dry areas, and that usually kind of eats away, in layman's terms, some of the dry.
Particularly the side of my feet, boy, on both sides. I had a bone spur last year, but around this time, but
but now you have cracked heels. or
Right,
cracked feet.
cracked sides and.
I would just
which
make
is
sure
very
you're
nice.
make sure you're moisturizing regularly. Some patients
Moisturize.
can't handle wearing socks at night and stuff, but if you can put them on, put socks on and kind of just let it kind of absorb the moisture,
Okay. Sucks. Okay, thank you.
of course.
All right, and Barbara, go ahead.
Okay, I forgot to ask this question before, even though you've answered part of it with someone else's question. I have, every summer, I get it in the summertime where my ankles start hurting and it sort of go across to my instep light. And, then winter, I'm fine. And like summer is coming, I expect it to happen again. And sometimes I have some swelling and it hurts, like feel very achy and tired. Do you know what causes
Do you
that?
do more in the summer than the winter? I don't know. Do you live somewhere that you
Well,
hibernate?
now with COVID, I'm not doing anything these days, but yeah, I'm used to being up and around, up and around. I exercise in the house now. I don't know. I don't think I do more. Yeah, I may do more in the summer.
Yeah, so most people, I mean, most people live someplace that they, we kind of hibernate a little bit in the other months. In the summer, we're like really excited to get up, get out there and do things. You don't have to be running a marathon, but even just getting out and you're walking, maybe you're walking an extra couple of steps because it's so beautiful outside now. And we've been, under dry gray weather for so many months. So maybe just be wear and tear as well. If you're having pain, like you described from, the ankle to the instep, sometimes it is the main support of the arch. So maybe the shoes you're wearing. In the summer, or in the winter, we wear boots, we wear closed shoes, we have a little bit more support. In the summer, we want to break out all the cute sandals, all the flats, all the slides we can get into. So your foot may be just kind of acclimating to saying, hey, wait, you gave me a little bit of support during the winter, and now you're completely allowing me to kind of collapse down. So it may be coming from your shoe gear in the summer too. So it's important to make sure you choose the right shoes in the summer. And you want to make sure that maybe those are kind of factors that's why you feel it in the summer versus the winter. Now, the other thing you kind of mentioned was increase in swelling and stuff in the summer. We retain a lot of salt and fluid intakes, especially if you're increasing your activity or with the hot weather. So it could have to do with that as well. And that would be more of the venous insufficiency, the swelling, and whatnot going on there. So maybe a couple different reasons as to why it's kind of going on.
Thank you. That makes perfect sense because yes, in the summer I tend to put on the sandals and walk free.
Yeah.
In the winter, yeah. Okay, that makes sense. Thank you so much.
Of course. Just make sure you're wearing good supportive ones.
Yes, thank you.